Hello everyone, welcome to my channel. Today we have another step 2 question for pediatrics. If you would like to see more step 2 questions, please like and subscribe. A 3-year-old boy is brought to the pediatric clinic due to persistent fever and worsening cough for 5 days. His parents report decreased appetite and increased fatigue. At 1 year of age, he required surgical drainage of a recurrent skin abscess near the buttocks. On examination, temperature is 39.2, heart rate is 130 per minute, and respiratory rate is 28 per minute, and blood pressure is normal. Lung oscillation reveals scattered crackles over both lower lung fields. Chest radiography demonstrates multifocal pneumonia involving both lungs. Despite treatment with a broad spectrum antibiotics, the child's fever persists. A CT scan of the chest shows enlarged hilar lymph nodes and a small pleural effusion. Biopsy of an affected lymph node demonstrates granulomatous infection. Cultures subsequently grow B. Capacia. Which of the following immune defects most likely explains this patient's susceptibility to infection? Okay, so we have a young patient. He's 3 years old, and uh, he's having fever and cough, and he had abscess before, and he has fever, and he has infection with B. cepacia, which is a catalase positive bacteria. And with that being said, let's go over the answer choices and to see what we got. A. X-linked agammaglobulinemia. X-linked agammaglobulinemia comes with lower globulin levels, and it leads to recurrent sinopulmonary infections, but it doesn't really present with abscess like we are having with this patient around the buttocks. And also we see infections with encapsulated bacteria, and B. Cepacia is not one of them. So I would say A is not the best answer choice. B. Complement dysfunction. Complement dysfunction is due to impaired opsonization, and it could basically um, uh, make patients susceptible to infection with encapsulated bacteria, but we don't see B. cepacia because that's a catalase positive bacteria. And also for both A and B, we won't see granuloma formation. So when you look at the biopsies for X-linked agammaglobulinemia and for complement dysfunction, we don't see granuloma production. So I'm gonna say B is not also a good answer choice. C. Chronic granulomatous disease. This disease comes with basically susceptibility to infection with catalase positive bacteria, which is what we are seeing here, and it also comes with abscess formation in patients, which is also what we are seeing here, and it also leads to many of the other symptoms we are having here, especially granuloma formation, as the name implies. So C, I would say, could be a very good answer choice. D. Leukocyte adhesion deficiency disease. Leukocyte adhesion deficiency doesn't lead to granuloma formation, and it does not lead to abscess formation, and but it does lead to basically skin and mucus infections, which is not what we are seeing here. C. Cystic fibrosis. Cystic fibrosis can lead to airway infections, but I mean, this is not what we are seeing here. It does not explain the granuloma that we are finding in the biopsy. It doesn't explain the susceptibility to basically catalase positive bacteria, And abscess formation, it's not explained by cystic fibrosis. So I'm gonna go with B. That's the correct answer choice. Thank you very much for watching and have a great rest of your day.